Greetings to everyone present. I am Dr. Riya Surti. I am practicing my Masters in Neurophysiotherapy from Sancheti Institute College of Physiotherapy. And today we will be seeing the topic hydrotherapy or aquatic therapy. Okay, so hydrotherapy or aquatic therapy. It is a newer form of physical therapy which is also used by different kinds of people who are associated with relaxation therapies or psychological therapies, and we will be diving deeper into this topic now. What is aquatic therapy? So, aquatic therapy is a set of therapeutic procedures applied in a pool by a certified practitioner in bringing about therapeutic changes in an individual using the properties and hydrodynamic principles of water to maintain, improve, or restore the body structure and function, and to overcome activity limitations and facilitate participation to fulfill their roles independently in daily life to the maximum extent possible. So basically, aquatic therapy is performed inside a therapeutic pool or inside a pool, and it requires the need of a certified practitioner because there are some risks involved and some safety factors that need to be considered while giving aquatic therapy to a patient. And I myself am a certified practitioner. I've done my beginner's course under Dr. Dipti Patil. She is a part of IATF, and let's dive deeper into aquatic therapy. So the physical properties of water. We'll be seeing four physical properties. First one is buoyancy, second one is hydrostatic pressure, the third one is viscosity, and the fourth one is surface tension. Buoyancy. So, the definition of buoyancy is that it is the upward force that works opposite to the gravity. So, this is basically the force that we encounter when we immerse ourselves into water, or we immerse one of our limbs into the water, that we can feel the floating feeling or the weightlessness feeling, which is known as buoyancy. So, the Archimedes principle states that an immersed body experiences upward thrust equal to the volume of the liquid displaced. So buoyancy provides the patient with relative weightlessness and joint unloading by reducing the force of gravity on the body. So this can be used in patients who have issues in terms of joint pain, and this is the reason for this is that there is joint unloading provided by buoyancy, which will reduce the joint pain, and in turn this allows the patient to perform active range of movement with increased ease because there's a relative amount of weightlessness, and it provides resistance to movement when an extremity is moved against the force of buoyancy. So if you try to move against buoyancy, this technique will be giving resistance, and thus you can train the muscles for strengthening of the movement. So the second property of water is hydrostatic pressure. The definition of hydrostatic pressure is that it is the pressure exerted by the water on immersed objects. Pascal's law suggests that the pressure exerted by a fluid on an immersed object is equal on all surfaces of the object. And as the density of the object and depth of immersion increase, so does the hydrostatic pressure. So basically, hydrostatic pressure is the pressure exerted by water on the object. So the effects of hydrostatic pressure include the increased pressure reduces or limits the effusion, it assists in venous return, it induces bradycardia, and centralizes the peripheral blood flow. The proportionality of depth and pressure allows the patients to perform exercise with more ease when closer to the surface. So when the person is closer to the surface, they'll be able to perform exercises more easily. That was about hydrostatic pressure. So in this picture, we can see that the body part is a three-dimensional figure and the water is all around the body part. So the hydrostatic pressure is applied all throughout the all surfaces of the body part, and greater the depth, greater the pressure. So as you go deeper into the water, you'll be experiencing more and more pressure, and it will be more difficult to exercise or move your limbs, and that will be again used in resistance training. The next property of water that we'll be seeing is viscosity. So viscosity is the friction occurring between molecules of liquid resulting in resistance to flow. Resistance from viscosity is proportional to the velocity of movement through the liquid. So water's viscosity creates resistance with all active movements. So this point basically says that increasing the velocity of the movement. So as fast you move, and the amount of surface area that you're covering through the water increases the resistance. So the more amount of surface area you cover through the water and your speed in water, both will increase the resistance of movement, thus giving strengthening effect. That was about viscosity. And the next property is the surface tension. So surface tension is defined as the surface of a liquid acts as a membrane under tension, and surface tension is measured as force per unit length. So the attraction of molecules is in water is parallel to the surface. The resistive force of surface tension changes according to the size of the object moving through the fluid surface. And an extremity moving through the surface performs more work than if kept under. So this point basically says that if you move your hand or your leg through the surface of the water, you will be having more resistance. And using equipment at the surface of water also increases the amount of resistance encountered by the object. Now coming to the hydrodynamic principles of water. So the first one is metacentric effect. If the forces of gravity and buoyancy are unequal and unaligned, then movement occurs, and that movement is always one of motion. The rotation continues until the two forces are once more in alignment, and describes the tendency to rotate when an object or water or body in water is asymmetrical. These torque forces can be used to increase the load on the connective tissue. Head and trunk control is required to correct the rotation, and selective limb movement is facilitated in this process. An asymmetrical patient can achieve swimming in a straight line. So according to this principle, these things can be used in pediatric patients as well. Coming to thermodynamics. So the specific heat is one of the things that we'll be seeing. Water is defined as having a specific heat of equal to 1, and a body immersed in a mass of water becomes a dynamic system. That is, it is no longer a static body. It is going to be in motion, or it will encounter some form of motion. Thermal energy transfer. The therapeutic utility of water depends greatly on both its ability to retain the heat and its ability to transfer heat energy. Heat transfer increases as a function of velocity. Thus, a subject or patient loses more heat when swimming rapidly through cold water than as a person standing in the same water. So the amount of movement you do inside of water, that will cause you to lose more and more heat. And this thermal conduction in combination with the high specific heat of water makes the use of water in rehabilitation very versatile, because water retains heat or cold while delivering it easily to the immersed body inside the water. Coming to the next point of resistance and impedance. Moving water or flow causes resistance. Like we have seen that resistance will be caused when there is movement. When there is more velocity, there was more resistance. So the examples of flow conditions, there are two types of flow conditions. One is the laminar flow and the second one is the turbulent flow. So the laminar flow, it gives a proprioceptive effect. Laminar flow is basically your stable, regular flow of water, where the water is more still and more stable. The second one is turbulent flow. So turbulent flow, it gives a resistive effect, because turbulent flow is irregular. It is made up of fast rotating water like eddy currents. It's sort of like a really fast motion of water. This is basically your turbulent flow. So normally we deal with turbulent flow during aquatic therapy, because there is no stillness or stable movement. There is basically more and more movement that occurs in aquatic therapy, which will cause turbulent flow of water, irregular rotating force of water. Coming to turbulence. Turbulence is a term which denotes the eddies that follow in the wake of an object moving through a fluid. The degree of turbulence will depend on the speed of the movement. Again, the more amount of movement will be caused through water, the turbulence will be more, and this will give resistance to the patient. If a movement is slow, then the flow of particles is almost parallel to the object and produces smooth continuous curves. It provides resistance to improve strength, balance, as well as core stability. Flow principles are used to increase the resistance, and faster movement produce eddies, like I said. So this is used in patients who, for example, if there's a stroke patient and if we want them to lift their limb, the lower limb, we can produce turbulent flow of water, and the turbulent flow of water will cause the person to make the movement. Okay, so that is how we can use turbulence in a clinical situation. Coming to drag effect. When an object moves relative to a fluid, it is subjected to the resistive forces of the fluid, and this force is called as the drag force. This force is due to the fluid viscosity as well as the turbulence, what we saw earlier. Eddies currents give a drag effect, and drag increases with speed. Again, as we saw, the turbulence increases with speed, drag as well increases with speed. An object that is stationary with respect to the fluid will certainly not experience any drag force. Start moving and a resistive force will arise. Like I said, the resistive force starts as soon as the drag effect will start as soon as you start moving and get moving faster, and surely the resistive forces will be greater. That was about the drag effect. Now we'll be seeing the effect of water on the different systems of our body. So the effects of water on the circulatory system is the first one that we will be seeing. So water exerts pressure on the immersed body. Like we said in the hydrostatic pressure concept, that water will be exerting pressure on the body which is immersed inside the water. Because an individual is immersed in water is subjected to the external water pressure in a gradient which within a relatively small depth exceeds the venous pressure, blood is displaced upward through the one-way system, first into the thighs, then into the abdominal cavity vessels, and finally into great vessels of the chest cavity and into the heart. So there is venous return which is increased. So the next point says that the venous return is enhanced by the shift of blood from the periphery to the trunk vessels to thorax and thus to the heart. Central venous pressure begins to rise with emotion to the up till the xiphoid process and increases until the body is completely immersed. Pulmonary blood flow increases with increased central blood volume and pressure, and typically at average pool temperatures, the heart rate lowers by 12 to 15%. The next one we see is the effects of water on weight control. Now, persons who have weight control issues can also use aquatic therapy as a measure to reduce the body weight. And aquatic exercise seems to offer the safest and most protective environment for obese individuals due to the effect of buoyancy in emotion, which minimizes the risk of joint injury. So we saw in the first point of buoyancy that buoyancy produces some amount of joint unloading, and it gives you a relative weightlessness, so that will minimize the risk of joint injury, and that is why water provides a really good medium for exercise in terms of for the obese individuals. With the body weight reduced to essentially negligible levels, the immersed individual can exercise vigorously, and increases in VO2 max are seen in obese individuals over a relatively short period of time. Now, the advantages of aquatic exercise include the heat conductive effect of water, which greatly reduces the risk of heat stress when exercise is done in cooler pools. The next one is that individuals with significantly increased body fat percentages are also protected against core temperature loss in cooler pool temperatures. And aquatic exercise programs may be highly beneficial for the restoration of fitness in obese individuals. That was the effect on weight control issues. The next one is effects of water on the renal and endocrine system. So the flow of blood to the kidneys increases immediately on immersion. Increased renal tubular transport occurs, renal venous pressure increases, and the potassium excretion increases with immersion. This is again an important point. The immersion-induced central volume expansion causes the increased urinary output accompanied by significant sodium and potassium excretion beginning almost immediately on immersion. So as soon as you immerse into the water, the excretion of sodium and potassium starts occurring, and this steadily increases through several hours of immersion and gently tapers over the subsequent hours. Next, we'll be seeing the effect of water on central and peripheral nervous system. So the skin sensory nerve endings are affected, including the temperature, touch, pressure receptors on the emotion of the body parts in the water. Sensory overflow has a mechanism by which the pain is less well perceived. So the pain reduction occurs when a person is inside of water, and the pain threshold actually rises. So the pain modulation is consequently affected with a rise in the pain threshold, which increases with temperature and water turbulence. And thus what happens that when the pain is reduced, a relaxation effect is produced within the reticular activating system deep within the brain. It is found that sympathetic nervous system activity is suppressed during immersion, and immersion increases the plasma dopamine and has a positive effect of mood. Coming to the therapeutic effects of aquatic therapy, there is reduced ground reaction forces. As we saw that there is joint unloading. It is easy to initiate resistance training inside of water than on land. It gives apparent loss of weight, enhances natural relaxation, and like we said, it uplifts the person's mood. It improves the circulation and reduces the edema, limits the effusion. It facilitates range of motion exercises, and it provides an enhanced proprioceptive input because there's 3D access of water to the body part of or the individual immersed inside of water. Improves the muscle strength and aerobic fitness. provides three-dimensional access to the patient, and you can initiate functional activity replication inside of water easily. So we have seen the effects of aquatic therapy on the different systems. So now we'll be seeing how you can use aquatic therapy for different kinds of things. So the first one being health and fitness. Like I said, that aquatic therapy is a really good form of exercise for people who are obese and for people who are looking to resolve their weight control issues. So health and fitness is one of those things. Women's health. Again, in women's health, we can see that aquatic therapy can be used since it provides a form of natural relaxation, and it will help reduce the tension in terms of the antenatal care as well as the postnatal care. Then geriatrics can be using aquatic therapy. The reason behind this is that it provides joint unloading, so the geriatrics can use aquatic therapy. It can also be used for recovery of sports individuals and as well as training for cardiovascular endurance, and in cardiorespiratory conditions as well. It can be used for pediatric patients because they feel more and more relaxed inside of the water, and the therapy becomes kind of fun for the patients and not just exercising. So it can be used for pediatrics, as well as it can be used for musculoskeletal conditions where there is joint pain involved, and for psychological reasons as well, because it uplifts the mood and it reduces the tension inside of your muscles. We also need to know some contraindications related to aquatic therapy. So the absolute contraindications in cases where you will not give aquatic therapy at all will be uncontrolled seizures. So uncontrolled seizures is where you have to avoid aquatic therapy. The second one is severe peripheral vascular disease. Even this condition will be avoiding. If there's some danger of bleeding or hemorrhage, we will avoid taking the person in water. Any contagious diseases, any active skin conditions or infections, and severe kidney disease where the patients are unable to adjust the fluid loss during immersion. In these patients also we will be avoiding aquatic therapy. Coming to the relative contraindications, if there is bladder or bowel incontinence, we will be avoiding, because again this will lead to the pool getting dirty and the whole purification process will need to be done. Second one is sensitivity to disinfectant chemicals. So first we need to clarify if the person has some sort of sensitivity, and accordingly we need to progress with the therapy. The third one is orthostatic hypotension. Fourth is hydrophobia. Hydrophobia is a relative contraindication because over time we can reduce the person's phobia of water. Fifth one is sensitivity to heat or humidity. The sixth one is acute illness. And the seventh is small open wounds or lines. In such cases of small open wounds or lines, we need to be careful that we are using some sort of waterproof covering for the wounds. We also need to know some safety rules for the pool users. So do not swim when you are hungry. Do not eat just before or during a pool session. You need to be hydrated. You need to eat, but that needs to be well before or well in advance before the hydrotherapy session. You should know which is the deep or shallow end of the pool. Do not dive unless the depth is adequate. So if you don't know how deep the pool is, you should not be diving inside of the pool. Do not go into the pool area without supervision. This is especially for children because they do not know the depth of the water. Hydrate yourself adequately post the session to replace your body fluids. It's very essential to keep yourself hydrated to avoid any unusual circumstances. Do not run near the pool sides because the pool side can be slippery, so that again needs to be taken into consideration. And we should know the emergency signal of stop, look and listen inside as well as outside of the pool. Coming to the equipment for aquatic therapy. So on the left we see the first one. These are dumbbells. Dumbbells can be used for resistance training inside of water. It can be either used on the surface, where the surface tension will act as a resistance for the person while using the dumbbells as well, or it can be used inside of water. Inside of water, again, your buoyancy will be acting as a resistance. That is about your dumbbells. And here we see that there are rings in different colors. So the rings can be used for different kinds of techniques. There's a technique called Badraga's ring method. We'll be seeing that. Not just that, apart from that, we can use a ring in this way as well. So the ring can be used for assistance inside of a pool. Next we have the surfboard, which can be used in case of stroke patients or in case of patients who need more assistance. You can use surfboards. You can use surfboards on for your upper limb or for your lower limb. You can also use surfboards as a form of resistance, where you will be pushing the surfboard downwards inside of water and you will be strengthening your limbs. Next, we have a neck pillow or a neck tie. This can be used for patients who lack neck control and you still want to take them inside of water. You can use this neck tie, and it can be gradually weaned off as the patient acquires the neck control. The next one is treadmill. Treadmill can be used inside of water as a form of aquatic therapy, which will provide a good amount of cardiovascular endurance. And the last one we have, these are floaters that you can see, which can be used on the ankle as well as the wrist. These are the equipments which we will be using for aquatic therapy. Okay, once more I would like to just sum up the equipments. So the first one was dumbbells. The second one was the rings which we were using. Rings can be used for Badraga sitting method, or they can be used for assistance as well. Again, rings can also be used as a form of resistance training. You can put your hand, or you can put a ring around your hand. So here you can put a ring around your hand and then you can try to push your hand down inside of the water, or you can even use it as a form of for the lower limb. You can use it again for pushing your limb down or taking your limb up. Again, one more method that you can use the ring in is for initiating sitting in a patient. You can make the patient sit inside the U shape of the ring. If it's a pediatric patient, it is even more easier for the therapist to make the patient sit inside the U shape of the ring, and thus you can initiate the sitting in a patient. That was the use of rings. And again, as I talked about the surfboards, then there are floaters. The floaters are not just for the ankle and wrist, they are also available like the normal floaters that are available for kids. Those also can be used for patients inside of the pool for aquatic therapy. And I talked about the treadmill as well as the neck collar. Coming to the various pool designs. So different sorts of pools can be used for aquatic therapy. One, we see the picture here down on the left corner. You can see a normal pool. A normal pool can also be used, but again, you need to be very careful of the depth of the pool, the depth that you want to take the patient into, you want to immerse the patient into, and the safety precautions and the risk factors should be taken into consideration. If there is no availability of the therapeutic pool, you can obviously use the pool such as a normal pool, and these normal pools can also be used for patients who are seeking for fitness or aquatic therapy. Such pools can be used, and a bigger pool can be used if a group therapy or a group class is supposed to be taken. Okay, so the size of the pool again matters. If you want to take a smaller individual, or if you want to take a patient in a pool, this is the top right corner, the top left corner. You can see that it's a 4 feet pool. It has stairs to descend into the pool, and the height of the pool is really low for the patient as well as the therapist. It is easier for the therapist to manipulate the patient inside a smaller pool. And again, there's a presence of a treadmill in this pool as well, and there are rods and grab bars everywhere around the pool. So in this is a proper therapeutic pool which is used for the patients. And most of these pools have the option of regulating the temperature, so you can heat up the pool, and it can be used again. Heat will provide a form of relaxation to the patients, and cold temperatures are generally not used for the pools. And here we have on the bottom right corner, we can see a smaller pool again, and you can see it has a grab bar throughout the pool for the safety precautions. And the top right corner, we can see the use of a treadmill like situation in terms of aquatic therapy. Here you can train for higher resistive training as well, and you can train for patients who have musculoskeletal issues like knee pain, ankle pain, hip pain. They can also use water for initiating walking or increasing their walking speed, increasing the endurance of walking. Okay, so these are the 4 different kinds of pool designs that can be used in terms of aquatic therapy, in terms of group classes or aqua fitness classes, and your walking endurance or walking resistance training. And pediatrics can also be using these pools.